As I said before, this is part of a three-part webinar series. So today we'll be talking about adolescent vaping, prevalence, why, and what. And I'll do my best to give you some good information. In the next few weeks, we're going to have a couple other webinars that will broaden out the picture and give you a fuller picture of vaping, because we can't cover it all in one webinar. And also you get to hear from other people in the field, which is great. So part 2 will be vaping and adolescent behavioral health, which will be on February 27th. And then vaping part 3, which will be more on prevention and intervention. So what are things you can do, or what are practices that are currently being done in schools and other settings on March 5th. So I encourage you to join those as well. Okay, the first thing I wanted to start with is by saying welcome to everybody who's out there. Appreciate your time this morning. Thank you for being with us. Last night I spent some time, I like data, and so I mapped where everybody's from, basically. So we have a visual here of all the states that you're representing in the webinar. We had over, I believe, 500 sign up. I don't have a count of how many of you are on currently, but these are all the states that are represented, including Puerto Rico and Hawaii, which I'm sorry are not represented on this graph because I couldn't get the figure big enough. But in any case, so welcome everybody from wherever you're coming from today, whether it be morning, afternoon, or what it be. So the other thing I wanted to say is I always like to give away free stuff, and free stuff in this case is you can visit our website. And there's a lot of information. Our center has been around for the past 6 years. We have a lot of recorded webinars that we've done in the past that are referred to today, a lot of different products that you could download, and other things to help the information and your learning in the various areas that we cover around prevention. So I really encourage you to take advantage of those products that we have. Okay, so I'm going to start. Rory, why don't you click through there's a number of animations. Why don't you just click through them all? So I'm going to start with a brief e-cigarette or vaping history. For this presentation, I'll use e-cigarettes and vaping probably synonymously. But I wanted to, because our webinar today is talking about vaping, I wanted to just give you some background. And as you can see here, it's more of a recent phenomenon as compared to other substances that we know about in terms of regular combustible cigarettes, alcohol, or cannabis. And e-cigarettes were first introduced into the US market in 2007, which is really not that long ago. In 2014, e-cigarettes turned out to be the most used tobacco product for youth. 2016, the FDA decided we should probably try to regulate tobacco-based products, including e-cigarettes. 2017, Juul became the most popular brand on the market. And then in 2018, depending on the literature you read, they took anywhere from 70 to 80% of the market share. So that's one of the reasons you may hear Juul a lot. And sometimes I know youth that I work with use it as a verb, say they're juuling, but it's actually a brand name. That's what it refers to. In 2019, there's a number of eval cases or electronic vaping and associated lung injury cases. And these are things that we typically forget about, unfortunately, but they were really problematic because these are times when we heard in the news when people were having things like really large damage to their lungs, in some cases, really extreme cases, lung transplants and so forth. And they thought it was part of the reason for that. There was vitamin E acetate that got contaminated some of the supply of e-cigarettes. Now, unfortunately, we quickly forget about those cases because what happened in the following few months was the international pandemic. But I just want to remind us that there's been some cases not that long ago of which some serious harm was done in terms of e-cigarettes. Bring us up to 2022, the FDA denies authorization to market our Juul products, but soon afterwards, there was administrative hold. So I guess what I'm trying to say with all this, it's a recent phenomenon, and honestly, there's not as much control or regulation on e-cigarette products or devices really as there is in reference to things like alcohol or combustible cigarettes. So that's one of the things I just want you to keep in mind. Okay, we can move on. Oh yeah, September, you've probably seen in the news, Juul was going to pay $440 million to settle states' vaping cases, and that was in reference to the idea that they were marketing towards youth. Okay. So 3 questions for today. I really want to ground our webinar around 3 questions. These are common questions that I get asked. One of them is how many adolescents are vaping, so we'll cover that. What are adolescents vaping? I'm actually going to break that question into two different parts because I think it makes sense. And then the third is why are adolescents vaping? So the prevalence of adolescent vaping, this first question, first of all, I want to point you towards a number of different data sources. There you have access to information from national data sources, for example, from studies like Monitoring the Future, and many of these studies have been going on for decades. National Survey on Drug Use and Health, Youth Tobacco Survey, Risk Behavior Survey, Youth Risk Behavior Survey, and so forth. And there's others as well. These tend to be ones that I focus more on in my work and research and so forth. But there's others. That what I really want to point out is these surveys don't necessarily ask the same questions. So when you look at these surveys, you may capture different data. And so it really depends on kind of what kind of questions you're trying to ask in terms of what surveys will be most useful to you in terms of answering that. In addition, there's also state-based surveys. So your own state may have its survey where they survey youth or adults or both. Here in Utah, we have the Student Health and Risk Prevention, or the SHARP survey, which we use. And I know there's a number of states that also use a similar version of that. Or also states I know use the Youth Risk Behavior Survey. So it turns out there also state-based information. What I'm going to be focusing on today is national information or national data, but that's just to some highlight where some of this information comes from. Okay, we can move on. So in terms of grades 8, 10, and 12, because we're talking about youth, and this is substance use in the grade by past 30 days. And the reason I focus on this is because one of the common questions I get are, what are the most frequently used substances? And it turns out alcohol and cannabis are two of the most frequently used substances. I have cigarettes on there too, which isn't used as much by adolescents, but actually are used more by adults. And then one thing I get asked about is prescription meds, and those are used at smaller rates by youth anyway. So I want to put this in a context, and we're going to kind of break apart. I know it says cigarettes, but if we move to the next slide, I'm going to put up a slide here about vaping. So this is actually vaping by grade, and it's 8th, 10th, and 12th. And these last two slides are from the Monitoring the Future 2022 results. But what you can see here is 30-day and lifetime use. Lifetime use we really consider experimental use, so has the youth ever used? 30-day use is what we tend to be a bit more concerned about, because these are saying in the past 30 days, individuals have used this, what we consider frequent users and so forth. And so if we just take 12th grade, you can see the progression across grades in general. Adolescents and youth are more exposed to substances, they're more likely to use substances. But if we just look at the past 30 days, about 25% of adolescents are saying that they're vaping a particular substance. So if we take that information and then we consider it with the slide I just showed you, turns out that in the past 30 days, alcohol use is most prevalent at about 28%. E-cigarette use or vaping is second, which is about 25%, and cannabis is about 20%. So those are the three most commonly used substances by adolescents. But vaping, we're going to dive into a little more because it's a bit different from some of the other substances I just mentioned. Let's move on to the next slide. But before we do that, you can just click through the graphics here, Rory. But before we do that, I just wanted to point out, it turns out that most adolescents, based on the data we just showed, are not using or are not vaping substances. So if we look at past 30-day substance use, 74% of adolescents are indicating they're not using a vape product, as where 26% are. So part of what I'll do is I'll give you show you some, or identify some misinformation that we typically have. One of the pieces of misinformation is that adolescents typically assume or perceive that their friends and their peers are using it at higher rates than they commonly are. So the old adage of mom, well, everybody else is doing it. And it actually turns out that not everybody else is doing it. And when we survey adolescents, it turns out when you ask them how many of your friends are using, they tend to report an overestimate by about a third of how many of their friends are using. But the reality is about 25% are actually vaping, which is good, right? We want that to be smaller, of course. And then the question becomes, why do some adolescents end up in the green part of the triangle and some end up in the yellow? And what can we do as a prevention field to help more of our adolescents end up in the green, or the adolescents in the yellow, how do we get them back down to the green? And we'll suggest a little bit about that towards the end, but that's really in part some of the interventions and prevention strategies that the third webinar will cover. Okay, we can move on. So what is vaping? So I broke question 2 into 2A and 2B. In the first part of that, I said, what is vaping? Well, first of all, again, it's a little bit different than alcohol or cannabis per se. And first of all, it involves a device. And we'll talk more about this in a sec. But there's different types of devices out there. And the technology of devices has increased dramatically. You can go online and see the technology and how they're increased, and how they differ, and how they market these things to youth and to adults and so forth. So one is that there's a device that you have to use. The second component is there's a substance, and there's different types of substances you can use, right? It's not just one substance, and we'll get to that in a second. And then the third part, if you put those two things together, it's really an interaction. So if you devices by substances equal many combinations. So if you think about this from a statistical perspective, interactions are complex. And the reason they're complex is because many things are interacting with many different levels. And so in terms, it really means we have many combinations. So we have many different devices, many different substances that youth are using. And that's one of the reasons that when we go back to our survey data, there may or may not ask the question that you're trying to get at. So what if you're trying to ask a question around specifically how many adolescents are vaping this product versus that product? You may not be able to get that information. Part of the reason is because e-cigarettes are really kind of new on the scene, and in part our surveys haven't quite caught up yet. But we're going to do our best to kind of delve into some of that information. Okay, let's move on to the next. So vaping basics, and there's some, can you hit the button, Rory? There's a few more. Keep going. Okay, so first of all, vaping basics. So what is vaping? Well, it involves an electronic device, which I talked about devices. This is from a CDC infographic. These are all available publicly. You can go online and grab them. And you can see the different devices that are out there. Probably more commonly, the devices in the middle, which looks like some type of USB port or USB drive, is more common, but they change all the time. Also, there's a liquid involved. So there's some liquid that you put in the device, or some substance, and we'll break that down a little bit more in a bit. Some substance that you put in the device heats up that substance, and then what you get is a vapor or an aerosol. And that's where the term comes from in terms of vaping. Okay, so that basically is what is vaping. We can move on to the next slide. And this is quite a few animations, so just click all through them. So the next question becomes, which I broke into 2B, is what are adolescents vaping? There's a number of different things. You can keep going, Ray. And it turns out there's a number of different things. There's 2 more animations, I think. And the main things that are vaping is either nicotine or THC, and THC is the active ingredient in cannabis that people use, and so forth. But we get all different names for these things. So what I'm trying to point out here is it can become confusing, but it really boils down to a few different things that at least at this point in time, most youth are actually vaping when they do vape. Okay, so let's kind of scroll again. So vaping substances, this is also monitoring the future data, 8, 10, and 12. Vaping substance by grade, we can see that nicotine and cannabis are the 2 most popular things, or so I would say the 2 most frequent things that adolescents vape. Okay, so cannabis in this case is THC, which is the active ingredient in cannabis, and the reason why people vape it. You can also see flavoring there, and flavoring without nicotine. Those are smallest percentages. What we know from the research study is that even when adolescents believe they're only vaping flavoring, there's many studies to show that there's also nicotine in the flavoring. It's not just that. Okay, why don't we go ahead and move on? So this slide indicates that this is nicotine, and basically one of the other questions that I commonly get is, well, aren't e-cigarettes safer in terms of regular combustible cigarettes? And we know a lot of bad things about regular combustible cigarettes in terms of how it's related to cancer and other things. And it turns out, yeah, by and large, probably what we know at the moment is there's probably less things that are expelled into the air, less things that are linked to cancer with e-cigarettes. But the problem with that is we don't have the data yet. It's still so new on the scene that we really don't have the decades of data that we have with combustible cigarettes. So my answer to that is, well, we'll wait and see. We'll see what happens, but we don't really know. But we have enough things to indicate that it's probably not good for you. And someone said safer doesn't mean safe. That's absolutely right. It means, you gotta, what I always work with adolescents is you gotta make your best decision on what you're gonna do with the substances that you put in your body if you decide to do that. But what this graph is really showing, because one of the common concerns that come up is it says, well, at least I'm vaping and I'm not using regular combustible cigarettes. Well, it turns out that the research suggests that those who vape are actually more likely to use combustible cigarettes later on. So you can look at the slide here from 12 to 17, 18 to 25, and 26 and older, and that yellow part is getting larger, which is only tobacco use, which is not vaping. So what the data are suggesting here, and also in this is not longitudinal, so we can't find causation from this, but what the data are suggesting is that as people get older, actually they're more likely to use combustible cigarettes. Okay, all right, let's move on to the next one. The other thing we know, there's two more animations here. Roy, can you just click those? The other thing we know, it's starting about 2017, 2018, roughly. This is just an illustration. This isn't actual data. Is that we've seen an uptick in nicotine. So the nicotine products that are vaped, basically. And we've also seen an uptick in THC and THC products that are vaped. So a nicotine example, average combustible cigarette has about 10 to 15 milligrams per cigarette. An average Juul pod is about 40 milligrams of nicotine. And a Juul pod, the equivalent is about 1 pack of combustible cigarettes. Okay. For a THC example, dried cannabis started at about 2 or 3% THC in the 80s to about 15% at present day. Some high strains may have about 20% or 30%. But in terms of concentrates, and that's another form of vaped cannabis, it's about what could be anywhere from 40 to 80%. So not only are we seeing an uptick of use, we're also seeing an uptick of the potency of these products, and our research isn't up to date yet. So what we know about how some of these products interact with the body doesn't match right now with what we know at the levels and the potency levels that people are using. So when we talk about what could happen, when adolescents ask me about what could happen, part of it is we don't quite know yet because we don't have those studies. Okay, let's move on. Okay, this slide I actually took from another webinar I attended back in 2019. And the reason I did is because it's just a great slide, and it indicates how not only I've said the technology has changed, the potency has changed, but also the chemistry has changed. So one of the things that Juul did is they patented what's called nicotine salts. And nicotine salts, what they do is they allow high levels of nicotine to be inhaled more easily and with less irritation than freebase nicotine. So if you try to smoke, here's the take home really. If you try to smoke a pack of cigarettes, which is about 20 cigarettes, one after the other, that's really hard for your body to do. But when you do things like add benzoic acid, it creates a compound called nicotine salts, and actually the body reacts to that much better. So it allows you to inhale a higher percentage of nicotine in a shorter amount of time with less negative effect on your body. So not only has the technology gotten better, but also so has the chemistry. And so in part, what we're seeing is an uptick, like I said, is the potency, but also the length of time. We've shortened the length of time in which you can get more nicotine into your body. Okay, we can move on from there. So third question, why are adolescents vaping? And this is a question that I have whole webinars on and parts, but we're going to cover it in brief. We're not going to spend as much time as I usually do because I've covered some other stuff. But basically, why are adolescents vaping is probably what we know from the research literature. It's a combination between environment and biology, which most things are. Okay, so why don't we move to the next slide? So we're going to cover some environmental factors. We'll consider those next. Okay, when we ask adolescents about why they vaped, and we consider when we ask adolescents or environmental factors, or we call them sometimes social behavioral factors, we kind of put this in a larger category called risk and protective factors. And risk and protective factors could be from many things, not just vaping, but other adolescent behaviors as well. So they don't occur in a vacuum. But what are reasons that adolescents who do vape say they vape? One is experimentation, right? Typically during adolescence, we know that there's risk taking and impulsivity. Another reason is taste and availability of flavors. So they have options, they have different things, and adolescents actually like novelty. The other reason is someone is using them who's close to them. So it could be a friend or family member. And we know from the psychology literature that modeling and implicit approval of use is really powerful for adolescents, seeing or being around someone else who's doing a particular behavior. And another reason is it's perceived to be less harmful than combustible cigarettes. There's a perception of risk that and this is based kind of on the health belief model. When people perceive things to be less risky, they're more likely to do them. When people actually perceive things to be more risky, they're less likely to do them. So if you perceive a particular substance as less risky than using another substance, you're actually more likely to do it. In addition, when I've asked adolescents these questions just on my own, they also tell me things like e-cigarettes compared to regular cigarettes are less smelly, gross, and they're easy to conceal, right? Or they don't make you smell like cigarettes, which are all things that can happen. So those are some of the things when we ask adolescents. Let's move on to the next slide. This is another study looking at vaping flavors. So if you think about vaping flavors and the variety of things that are out there, adolescents like variety, and some flavors tend to be more popular than others. You can see in this slide that mint is one of the most popular flavors. So when you see sometimes legislation come out in the news, they may target particular flavors. In part, that's the reason they do it, right? And you may think, well, that's great. You know, they target a particular flavor, so it's harder to get. Let's move to the next slide. Well, unfortunately, teens find a way around that, and the legislation many times has loopholes. And in this loophole, when they actually targeted things like mint, which you saw on the prior slide, which is really one of the most popular flavors, it turns out what they didn't say were restricted were disposable e-cigarettes. So adolescents or youth just moved to disposable cigarettes where they could get that. Okay, so what I'm trying to say is the legislation doesn't always match what we know is kind of best practice in terms of that. Okay. Let's move on again. The other thing I want to say, this is a CDC infographic. Again, you can find this on the web. The reason I point this out is because it refers back to one of the things we were just talking about in terms of perception of risk. One of the things I hear all the time from adolescents, they're less harmful than regular cigarettes, right? Well, yes, but it doesn't mean that e-cigarettes are safe. And I think someone brought that up in the chat earlier. We know that e-cigarette aerosol generally contains fewer toxin chemicals than the deadly mix of, 70,000 chemicals. I'm sorry, 70,000 chemicals from regular combustible cigarettes. But honestly, what I tell adolescents is we don't have the research yet to know what harm they're going to produce later on. We anticipate it will, but we simply don't have the long-term research at this point. Okay, move on to the next slide. Another one I commonly hear is just, and again, this is from the CDC, it's just water vapor, right? And I hear this a lot from adolescents who think they're just smoking flavoring or vaping flavoring. And it turns out, we have a lot of studies when adolescents think they're just vaping flavoring, they're actually also vaping nicotine, which is contained in the flavoring, even if the packaging doesn't say that. And it's not well regulated. So if you think you can buy the packaging and trust it, honestly, we have many studies that say you can't. So some of the things we know that are in these aerosols are things like nicotine, organic compounds, ultrafine particles, flavoring that are not linked to good things, heavy metals, and other cancer-causing chemicals. Long-term impacts, we don't know yet. So that's where we will figure out. So that's some of the things around thinking about perception of risk. So when we think things are lower risk, we're more likely to do them. Okay, let's move on to the next one. Okay, so this is based on a state study that we did here at the University of Utah that I was the lead author for. And what we did here is we looked at frequent e-cigarettes compared to no e-cigarette use. So basically we looked at adolescents. These are all adolescents in 6, 8, 10, and 12 grades. Okay. Between adolescents and those various grades, and what you can see on the slide here are various Risk and protective factors, you can see the different domains: individual, peer, family, school, and community. On the right side, what you see is our effect sizes, but I'm not so concerned that you know about those. Basically, what I want to show is there's different risk and protective factors. So Roy, can you hit the animations for the next few? I think there's going to be 2 more. Okay, so what, nope, yeah, there you go. So what you can see here is on the right side, the red ellipses, basically, because I've made those easy for you to see. The red ellipses indicate what's more of a risk factor. So when those things are higher, when an adolescent endorses those things more, they're more likely to use e-cigarettes or vape in the past 30 days. The highest one there is peer use. When adolescent is around others who use, they're more likely to use e-cigarettes. And we know this from, this isn't, breaking news. We know this from other substances as well. And it continues on for e-cigarettes. When you can see the other one there, the second highest, when adolescents have favorable attitudes towards substances, they're more likely to use it. And also when they have peers who have favorable attitudes towards substances, they're more likely to use it. Now, what are some of the protective factors, right? Perceived risk. So when adolescents, on the green ellipses, when adolescents perceive that e-cigarettes are harmful to them, they're less likely to use it. Also, when they perceive that other substances such as cannabis are harmful to them, they're less likely to use it. In addition, one of the other things we found is the family management. When they perceive their family management is better, they're actually less likely to use. So the takeaway here is really perceptions, attitudes, proximity to others, and family actually matters when we think about how some of these risk and protective factors influence what adolescents are actually likely to do. Okay, let's move on to the next slide. This is the second study that we did with the same data sets, and this is commonalities and differences, because one of the questions I get is between risk and protective factors, well, how is that similar or different across substances? And it turns out it may depend, right? And it may depend in part on the substance. So you can see at the top here, favorable attitudes. When adolescents have favorable attitudes towards alcohol, cannabis, or e-cigarettes, they're more likely to use them. But if you go down to the protective part, when they have perceived risk, actually that one didn't turn out for us in terms of alcohol. There's no association, but there was for cannabis and e-cigarettes. So the takeaway I think really here is, I'll know from a prevention perspective, sometimes we treat substances similar, but there may be some nuanced opportunities for us to treat substances differently, depending on if we're looking at it from a risk and protective factor profile. Okay. So we're going to move on now. So those are some of the kind of more environmental things. We're going to move on now to some biological factors, change gears a bit. And the cool thing I like about this is in the past 20 years from the neuroscience, we know a heck of a lot more about adolescent brain development than we ever have. Probably is in the next 20 years, we'll know even more. So we'll be able to answer better questions and so forth. When I do these presentations in person, one of the first things I ask is, what do we know about adolescent brain development? Typically, people say, well, the brain isn't fully developed until a person's mid-20s. 20 years ago, if I would have asked that question, most people wouldn't have said that. So what I'm trying to get at is it's really great that this information ends up in the public sphere about adolescent brain development and so forth. The other thing I want to point out is these concepts that I'm going to present to you are not mystic. They're not supposed to be just for us and no others. I've taught these same concepts to 6th graders as well as adults. And it turns out when we have better information about what we're doing, we make better decisions. And that's one of the reasons I teach these concepts to youth as well. And I'll show you some videos that we have at the end that you can also use. Okay, why don't we just go ahead and click through all the. Okay. So what I really want to point out here is we have 3 components of the brain. We're going to make this easy. This is not a biology class. We have the bottom part of the brain, which we consider the brainstem for this webinar. Limbic area of the brain, which is the emotional part of the brain, contains some substructures like the amygdala, which was related to the fight or flight response, hippocampus, memories, hypothalamus, hormones, especially important during adolescence. Top part of the brain, which is the prefrontal cortex. So what we really want to focus on is in the middle part of the brain, and there's a reward pathway in the middle part of the brain that is really coming under development during adolescence, in part because those are related to things like puberty and other things, other changes that are going on. And probably what you've heard is the brain doesn't fully develop until a person's mid-20s. Well, actually, there's a huge variability in that, right? So some 15-year-olds will make better decisions than some 25-year-olds and vice versa, because there's variability, because in part, there's variability in what we're exposed to in terms of the environment. But what we think is really happening in that top part of the brain are these interconnections between the neurons, have the opportunity to make connection, but they don't fully make all those connections until a person's mid-20s, and that's probably related to experience and exposure. But the limbic area, or the middle part of the brain, is really taken off during adolescence. So the idea here is, if the middle part of the brain is really developing during adolescence, but the top part of the brain is not, that emotional part of the brain will take over more than the top part of the brain in terms of have brakes to stop it. So when I've taught this concept to sixth graders, they told me, well, it's kind of like having a Ferrari engine in the middle part of your brain, but brakes that are made for, let's say, a car that doesn't have a Ferrari engine, right? So some smaller car, and so forth. The idea is that the brakes can't really stop what that engine is doing. And if we think about how powerful a Ferrari engine is, and they're pretty powerful, if you don't have the braking system to stop that engine, it could be problematic. So the idea is that there may be some disconnect in terms of development between the middle part of the brain and the top part of the brain. Okay, let's move on to the next part. So we got that part, right? So what I really want to point out here is that adolescent risk-taking, impulsivity, and control, that risk-taking, these are things that we normally anticipate during adolescence. If we think about risk-taking or sensation-seeking, these are typical components. And we think the reason this is happening is because of development in part of that reward pathway that I indicated in the middle part of the brain during adolescence. Adolescents are supposed to sensation seek and seek out novel sources. That's part of our biology. That's part of what's supposed to happen. Also, that correlates with impulsivity in terms of the risk-taking, and it tends to be more of an emotional rather than a cognitive process that happens really quickly. There's not a lot of thinking involved. What we say when the top part of the brain doesn't fully develop until the person's mid-20s is that top part of the brain, which is the cognitive control. So again, this gets back to, if we're doing risk-taking and impulsivity in the middle part of the brain, but that top part of the brain isn't fully developing, we could see some problems there in terms of stopping behavior or thinking about behavior before we act, or delaying consequences, whatever that may be. So these things, what I want to say, are really consistent with typical adolescent development. But sometimes what happens is the substances get mixed up in that, right? So if we think about that middle part of the brain, in particular, that reward pathway, what we know is that when that reward pathway is activated, it increases in neurochemicals, and one of them is the neurochemical dopamine, right? So that reward pathway gets activated, increases that middle part of the brain. What we also know is other chemicals get released, such as like cortisol and other things, and it slows down the top part of the brain. Okay, so if we use an analogy, if you put your hand on a hot stove, typically your brain reacts really quickly. It's that middle part of the brain that's reacting. It's actually the amygdala. We believe it's the amygdala fight or flight response. So your hand doesn't spend too much time on that stove, in part because you don't want your brain to think about it. You don't want that top part of your brain to kick in and say, hey, I really want to think about whether my hand should be on the stove. No, actually, you want it to take it away. Okay, we see that in the brain, and that's what it's supposed to do. Unfortunately, when we use particular substances, and we think all substances have some relationship to that reward pathways, what substances do is they increase the dopamine in that reward pathway, and they actually exaggerate it beyond what would normally be expected. Okay, so let's move on to the next slide. And I know that was a lot to take in, but I've done whole hour-long webinars on the brain stuff, and you'll have access to those too. So, but what I want to talk about is the effects of nicotine. Nicotine is a powerful substance, and what we know about adolescents' brains compared to adult brains, and many of these are from preclinical studies, meaning rat or mice studies, is that we know that adolescent brains are actually more sensitive to rewarding effects of nicotine. Okay, withdrawal from nicotine is also more blunted in adolescence, and higher doses of nicotine are tolerated better. And also the enhances of nicotine, the effects of use of other substances such as alcohol, cocaine, or methamphetamine are also enhanced when using nicotine. So the take home here is you have a higher susceptibility to other substances. So think about it this way. If I was marketing my products towards people that I wanted to use them, I would absolutely definitely market them towards adolescents if I was a nicotine marketer. Now I'm not, and I'm not saying you should do that, but it turns out these companies have all the same research and they know this. So when I hear information that says, companies don't market towards adolescents and so forth, regardless of that, from a business perspective, it probably makes, unfortunately, really good sense to market towards adolescents because they know from the chemistry here involved and also the behavioral development that are really susceptible to using these substances. The other things we know, just taking away some common things that you're probably already aware of, about 90% of people who smoke start smoking before they're 18. Okay, so many of these things start in adolescence as opposed to adults. The other thing we know is in terms of cancer, if we got rid of combustible cigarettes, about a third of cancers we'd get rid of as well. So we have a lot of information in terms of nicotine and combustible cigarettes, but we don't quite have all that information yet in terms of the effects on vaping. Okay, let's go ahead and move on. Okay, so here's kind of taking, you go ahead and go through all these here, taking kind of what we learned. Here's kind of Jason's idea of what are some potential pathways to vaping. So why would some adolescents use vaping products? There's some more animations where you can scroll through those. So if you think about what we said, one is exposure or modeling. Exposure to things like advertising. Modeling is modeling behavior, and that famous psychologist at Stanford, Alfred Bandura, taught us about how modeling is really important because we learn behaviors from others by having others model those things for us. So around other people who use, and also the idea that there could be a low perceived risk of using vaping products and so forth. In terms of we move on then to risk-taking and experimentation and impulsivity. These are all things that we anticipate during normal adolescent development. So we have plenty of devices out there. They're easy to get. It's easy to click on, I'm over 18 or over 21 if you're on the web, and get those delivered to your door. There's plenty of flavors out there. If your mint just got banned, you can actually get it in a disposable format now. There's many products. It's very accessible and it's easy concealment. Okay, all those things appeal to adolescents. And then, but what moves someone on to occasional use or regular use? Well, what we think is that it's the potency of the nicotine and or the THC, depending on what they're using with the adolescent brain. So if you consider what we just talked about in terms of the middle part of the brain, that reward pathway, we think at some point there's actually an interaction that's taking over in terms of increasing those levels of dopamine and slowing down the front part of that brain in terms of that use. And if you think, so one is tolerance, right? So if we think about this from a clinical perspective, one is tolerance. So the idea is that we have to use more of the substance to get the same effect. And so adolescents don't stop with the particular substance, but they actually end up using it more often. Now, the downside of that is when that chemical interaction takes over in the brain, is we also have something where you could just say, well, just stop, right? Just stop using. Well, the downside of that is our body also changes, right, and reacts, which is good in some ways, to that over-exaggeration of dopamine in the neural pathways. But the problem is that when we stop giving it that dopamine, it says, no, you're not going to do that. I want it more. So then we experience things like withdrawal. And so if you've ever tried to stop using cigarettes or other substances, your body reacts to that in a really negative way. And part of what we think is happening is your brain is actually telling your body, I don't want less dopamine. I actually want the amount that you used to give me. And that's why I'm going to make you feel so bad. Okay. And these are all things, again, that I've explained to adolescents, working with adolescents and adults, but it gives them information about how these things, at least at this point, how we think it works. Okay, let's move on. Okay, so review, actually, we moved through this pretty quickly. Review our 3 questions for today. How many adolescents are vaping? It turns out, just some takeaways here, by grade 12, about 40% of adolescents have tried vaping, and about 26% have used in the past 30 days. Question 2A, what is vaping? It's an interaction between a device and a product. There's many combinations, and I think I saw some things in the chat. There are absolutely many combinations, and they're changing faster than we can actually survey them. Question 2B is current data indicates primarily nicotine and cannabis in that order. In terms of what they're using, potency levels have also increased. But if we do that, if we survey again, if we continue to survey, that can also change, right? In terms of what adolescents are using. In question 3, reasons why adolescents vape. Most likely it's an interaction between environmental biology. Adolescents' brains are set up for experimentation and sensation seeking. At some point, what we believe is the chemical, either nicotine or THC, will interact with brain chemistry, and that'll take over as well. And that makes it one of the reasons why it's so hard to change that behavior. Okay, let's go to the next slide. Okay, I've told you a lot about a lot of these things. You know, not everybody likes to sit through an hour-long webinar. And adolescents, and typically we built these things for adolescents. Adolescents like short pieces of information. These are actually two videos that are under 2 minutes that explains the effects of substances on the teen brain and the effects of substances on the teen body that you can use if you're working with adolescents. You can use them with them, but it really gives you, it's only 2 minutes, so it's not going to be in depth. But these are things that we've created for social media or whatever, but really to capture a quick attention span, so we get that information across. Again, if we just think about the problem-solving literature or decision-making literature, we tend to make, adolescents included, we tend to make better decisions when we have more accurate information. My experience is that adolescents tend to spend more time researching their next iPhone purchase than they do the next substance they're going to put in their body. So I want them to have the most accurate information we have out there on what we know about these particular substances, even if it is we don't yet have that research to say what some of the long-term effects are in terms of vaping, which we're still working towards in terms of we don't. Okay, we can move to the next slide. Okay, so this is the end of the webinar.